Hi everybody, it's Elisa again. Well, from this chapter, I will share each kind of mental illness because mental illness is not just like somebody say it's crazy. Somebody is crazy, but no matter their speech, no matter their behavior, just crazy. Crazy isn't so simple to describe the whole mental illness. So from now on each chapter, I will introduce each of one type of mental illness. And today, I would want to share with you is what is schizophrenia. Well, actually, I got a psychiatrist. Her name is Joyce. Every time when I, upload the videos, she just keep meowing and meow, 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 and non-stop until I stop videoing. Heard that? Just a second. She's my beloved Joyce. Okay, just say hi to everybody in YouTube. Hello. Yes. Do you want to know what is schizophrenia? Yeah, you want to know that? Yeah, you want to know that what is schizophrenia? Oh, okay, I know that. You want to know that? Let me tell you, it's okay. But don't disturb mommy, okay? Ah, okay. Well, it's just funny beginning. Okay, to be serious now, I will tell you what is schizophrenia. Schizophrenia actually is a chronic brain disorder that affects about 1% of the population. When schizophrenia is active, symptoms can include delusions, hallucination, trouble with thinking and concentration, and lack of motivation. However, when these symptoms are treated, most people with schizophrenia will greatly improve over time. While there is no cure for schizophrenia, research is leading to new, safer treatments. Experts also are unraveling the causes of the disease by studying genetics, conducting behavioral research, and by using advanced imaging to look at the brain structure and function. These approaches hold promise of new, more effective therapies. The complexity of schizophrenia may help explain why there are misconceptions about the disease. Schizophrenia does not mean split personality or multiple personality. Most people with schizophrenia are not dangerous or violent. This is the main point I want to say. I want to emphasize that most people with schizophrenia are not dangerous or violent. They also are not homeless, nor do they live in hospitals. Most people with schizophrenia live with family in group homes or on their own. Research has shown that schizophrenia affects men and women about equally but may have an earlier onset in males. Races are similar in all ethnic groups around the world. Schizophrenia is considered a group of disorder where causes and symptoms vary considerably between individuals. Now I want to talk about the symptoms of schizophrenia. When the disease is active, it can be characterized by episodes in which the patient is unable to distinguish between real and unreal experience, just like this. And with any illness, the severity, duration, and frequency of symptoms can vary. However, in persons with schizophrenia, The incidence of severe psychotic symptoms often decreases during a patient's lifetime. Not taking medication as prescribed, use alcohol or illicit drug, and stressful situation tend to increase symptoms. Symptoms fall into several categories. First one is positive psychotic symptoms. Hallucinations such as hearing voices, paranoid delusion, and exaggerated or distorted perception, beliefs, and behaviors. Number two is negative symptoms. A loss or a decrease in the ability to initiate plans, speak, express emotion, or find pleasure. 3. Disorganization symptoms. Confused and disordered thinking and speech, trouble with logical thinking, and sometimes bizarre behavior or abnormal movements. And 4. Impaired cognition, problem with attention, concentration, memory, and declining educational performance. Symptoms usually first appear in early adulthood. Men often experience symptoms in their early 20s, and women often first show signs in their late 20s and early 30s. More subtle signs may be present earlier, including troubled relationship, poor school performance, and reduced motivation. It is rarely diagnosed in children or adolescents. Before a diagnosis can be made, however, a psychiatrist should conduct a thorough medical examination to rule out substance misuse or other medical illness whose symptoms mimic schizophrenia. Researchers believe that the number of genetic and environmental factors contribute to causation, and life stresses may play a role in the disorder's onset and course. Since multiple factors may contribute, scientists cannot yet be specific about the exact cause in individual cases. Since the term schizophrenia embraces several different disorders, variation in course between cases is expected. Treatment can help many people with schizophrenia lead high productive and rewarding lives. As with other chronic illnesses, some patients do extremely well while others continue to be symptomatic and need support and assistance. After the symptoms of schizophrenia are controlled, various types of therapy can continue to help people manage their illness and improve their lives. Therapy and support can help people learn social skills, cope with skill, identify early warning signs of relapse, and prolonged periods of remission. Because schizophrenia typically strikes in early adulthood, individuals with the disorders often benefit from rehabilitation to help develop life management skills, complete vocational or educational training, and hold a job. For example, supported employment programs have been found to help persons with schizophrenia obtain self-sufficiency. These programs provide people with severe mental illness with competitive jobs in the community. Many people live with schizophrenia receive emotional and material support from their family. Therefore, it is important that families be provided with education, assistance, and support. Such assistance has been shown to help prevent relapses and improve the overall mental health of the family member as well as the person with schizophrenia. Optimism is important, and patients, family members, and mental health professionals need to be mindful that many patients have a favorable course of illness, that challenges can often be addressed, and that patients have many personal strengths that can be recognized and supported. Related conditions including schizoaffective disorder, delusional disorder, brief psychotic disorder, schizophreniform disorder, and catatonia. So this is the simple introduction of schizophrenia. If you or your family members or your friend get schizophrenia, don't be afraid. Just go to the doctor and they will do the very good things to help you, to prescribe medication for you, and afterwards you will be just like a healthy well-beings. Okay, talk to you at this moment. See you next time. Bye.